Hello, my name is Anne. I'll be demoing the ultrasound scan demo of thyroid gland today. So I'm going to use 18 linear probe. It's the highest resolution probe. And I have a patient in supine position. And I put pillow underneath her shoulder and neck to stretch her neck, but not too much. So to begin with, I'm going to do quick sweep through the whole gland, thyroid gland. On transverse views, I'm going to decrease the depth a little bit and sweep through to check if there's any pathology to address during the exam. And I'm going to check the homogeneity and contour too. And my first image would be the isthmus. So I'm going to find the widest area and zoom in a little bit. And I'm going to find the widest area of isthmus to measure. I think I got the good area to measure. So I took the picture and then measure from isthmus hyperechoic region to hypoechoic region. And then the whole thyroid gland on transverse view. So I'm gonna adjust the depth to focus on the thyroid. So we can see the trachea in the middle and then the vein, common carotid and artery and vein a little bit there. So I'm going to a little bit decrease the gain, but not too much. Adjust the color. And next, I'll do quick sweep through the right lobe on longitudinal view from lateral to medial. So from the carotid artery to all the way to the middle, from lateral to medial, quick sweep through. And this patient, I don't think the patient got any pathology on the thyroid gland, which is good for the patient. So I'm going to take the picture from carotid to all the way to the medial, to isthmus area. And I'm going to get the midline of thyroid right lobe. And I'm going to measure the length and height. Take a picture and then measure with caliper the length and then height, the widest area, measure it and take a picture. And then I'm gonna turn the color on. To assess the vascularity. Okay, I'm gonna take the picture here. And next I'm gonna do the transverse view, sweep through the right lobe from superior to inferior. So I'm gonna find a good window here from the carotid artery all the way to the down. And I'm gonna just make sure if there's any pathology on the thyroid gland. If we have the pathology on patient's thyroid gland, we can just measure on transverse and longitudinal view and then just the color on it and report. But on this patient, I cannot find any pathology on right lobe. So I just took all sweeping images, and I just got the widest area to measure and width. So from the common carotid artery to trachea. And the next left lobe is the same order, the longitudinal sweeping from lateral to medial. So I'm going to ask the patient to turn her neck toward me to get the left lobe. So quick sweep through from lateral to medial to isthmus. So from carotid artery, and then just sweeping through the left lobe. So take a picture here, and then to the medial. All the way to the medial to isthmus area. That will be my last image. And I'm gonna get the midline of the left lobe and the measure. So I'm gonna erase the label and measure the widest area for width, the length and height. And next, transverse view of the color. I just turn the color on and took the picture. And then the transverse view. It's the same quick sweep through. The left lobe from superior to inferior. So quick sweep through to check if there's any pathology like nodule, simple cyst. And took the picture all the way down. And this patient has no pathology on the left lobe too, which is good for this patient. And I'm gonna get the widest area to measure on left lobe too. And that's it. I think I got this here, and I'm gonna measure from trachea to carotid artery for width. Okay. And I'm gonna take a report image. Okay, so acquire report. And that's it. This is my ultrasound scan demo of thyroid gland. Thank you for watching.